What's up, everybody? You're listening to the Strength and Knowledge Podcast. This is your host, Dr. Zach Baker of Rehab to Perform and R2P Academy. And today we have a special guest on with us, Matthew Ibrahim. And Matt, I'm trying to actually think back to when we first crossed paths. And I think we actually crossed paths because you came across my Instagram feed. And I saw that Josh and a couple other people I know were interacting and engaging on some of your content, started following you. And then since then, I've just been always impressed and appreciative of the types of material you are putting out for people to see, your ability to communicate things very clearly and in a practical way. And then we've kind of just informally stayed in touch since then. So I will let you kind of introduce yourself and give the listeners a background of who you are, what your current role is, and kind of what that journey's looked like to get there.
Well, Zach, thank you so much for having me on, man. I've been a big fan of your work, of Josh's work, Rehab to Perform, the Academy. You guys do an amazing job out there. And so it's great to link up off of Instagram, right? Like we all talk about, I know so-and-so, I'm friendly with so-and-so, but it's always great to get in a call or a Zoom or just to chop it up. So thank you for having me on. I really appreciate it. For me, this is always the hardest part. Like, what do you do? What's your current day to day? Like, what role are you in? For me, I view everything that I do, every opportunity that I get, I view myself as a coach, and that allows me in my mind to simplify that. I'll explain. So right now the office I'm sitting in is at Endicott College here in Beverly, Mass. It's about 30 minutes north of Boston, Mass. Endicott College is it's waterfront college campus is beautiful. So I'm in the School of Sports Science, specifically in the exercise science department. We have roughly 200 to 225 exercise science students. My primary role is the clinical coordinator of exercise science, so internship coordinator, if you will. So our college requires not one, not two, three internships in those 4 years. So that's my primary role, helping students land internships near and far, utilizing my network and our network that we've developed for whether it's physical therapy, whether it's strength conditioning, obviously my bread and butter, occupational therapy, it could be PA, it could be, cardiac rehab, exercise physiology, sports science, could be nutrition. And there's a wide variety of health and wellness, exercise science-based professions, as we know. So it's just helping those students land those gigs, professional skills, communication skills, mentorship, that type of stuff, which I love. That's half of my job. The other half is being a professor of exercise science, where I predominantly teach the exercise program design course. I will hold that tight to my chest until someone pries it away from me. I teach a handful of internship-related courses, as well as introduction to exercise science, that freshman year, that classic course, where I get to introduce students to the field, generally speaking, and I'll bring in people from my network in all sorts of fields to talk about their career paths, S&C, PT, OT, AT, DC, like all the different career paths, so that students can have a really good understanding of, okay, maybe I want to go that way. Maybe I want to go this way. Maybe I want to combine these two things. So that's where I'm at now. From 2007 to 2021, I was a full-time S&C coach, up until the point where I was co-owning facility, director of S&C, internship coordinator, from roughly 2021 till halfway through 2022. I describe this part of my life as being a nomad. I was an adjunct professor at two institutions here, part-time at Endicott and online at Maryville. Maryville University in St. Louis, Missouri, online, as well as training people and folks in their homes, clients, high school athletes, some college athletes, some youth athletes, doing some online training, a lot of travel and speaking engagements through NSCA and Perform Better, and to this day as well, and working on the PhD. So that has got to me where I'm at now. And again, the biggest, most important thing is everything that I get to do, I view as a coach. Whether I'm teaching you in the classroom as a student, whether I'm educating you at speaking at a course, NSCA, Perform Better, et cetera, whether I'm actually working in the weight room, because I still volunteer here in the weight room with our D3 athletics, women's and men's basketball and football, a couple hours a week, more like in a volunteer and consulting role and the programming role. And so everything I do as a coach, and that's where I'm at now.
I love that kind of mindset. We have similar roles where I work with Rehab to Perform, and I do patient care a couple days a week. From an administrative side, I oversee our sports residency as a program director and have some mentorship and didactic teaching roles within that as well. I am an adjunct faculty at a few PT schools, kind of the nomad lifestyle as well.
Yep.
And then also oversee just clinical operations as a chief clinical officer. But I bring that up because I'm very similar. Regardless of the day of the week, I always have the same theme and the same mission, which is one, get better personally and professionally, seek out others who have similar mindsets that I can learn from, pass along that information in ideally like a productive conversational manner to those on our staff, and figure out how do we continue to push the field of physical therapy in a positive direction, elevate the floor of the profession, and make sure that, hey, whenever you come into a clinic at R2P, if you get the worst circumstance with somebody on staff who is having the worst possible day they could have for whatever reason, you're still having a really, really good PT session. And then there's a lot of other people that, like yourself, who are PhD educated and have specialties in different areas that can continue to push the ceiling of different professions. And it's funny, I think I got to a crossroads pretty early in my career where I realized I don't think I'm ever going to be the smartest person within a company or within a room. But I think what I enjoy doing is working as a team and trying to find where different pieces fit together and what people's strengths and weaknesses are. You had mentioned being in that more of that S&C role from 2007 to 2021. What really prompted the transition in your career of going into a more full-time academic space?
Great questions. And I love what you had mentioned there. I think the biggest thing is being surrounded by a team and working together toward a common goal. And so that's something that I missed. I miss a lot from S&C, but I get here academically. But the transition, the reason why it's the number one reason, which has been the driving factor since day one, was it took me personally 6 years to get an undergraduate degree. I failed out on 13 classes, got put on academic probation. It took me 6 years to get a 2.961 GPA and literally just pass. So I say all that because I didn't apply myself. I wasn't putting the work in. I didn't care. And having gone through that, you can either say, hey, it's your fault, it's your fault, it's your fault. You say, you know what? I'm a thumb person, not a pointing finger. I'm a thumb person. That's on me. So since then, my mission has become to pay it forward to the undergraduate exercise science student who maybe is dealing or was dealing with similar issues of lack of application, wasn't applying themselves, didn't have a good understanding of how to connect the dots from theory like lecture to hands-on practical application in the weight room or in the S&C Performance Center, et cetera, et cetera. So that's been my mission. It's also, I think, trying to connect the dots for young professionals, because I think what education does a really good job at, generally speaking, is teaching you the theory, right? Okay, here's a lecture, here's what you need to know, here's the X's and O's. I think the biggest area that we all strive to, whether it's PT school, S&C, exercise science, whatever, kinesiology, X-phys, whatever, is how do you then take those concepts and apply them in a real world setting? Because you and I both know the variable that always changes and always evolves is the human being in front of you. So for me, it's like, hey, how can I become that bridge to help the student understand how to apply by using simple communication that's effective and allows them to understand connecting dots from theory to application. So that's been my biggest driver, because I failed. I said, okay, how can I help someone who may be failing? How can I meet them? Because I understand where they're at. I've been there. 13 failed courses, academic probation. I fully comprehend 6 years, right? So that led me to get into S&C because I love helping people. I've used S&C as a vehicle for positive change with athletes and clients. All the while, getting my master's, getting my license in massage therapy. I still pay the dang yearly fee for the credential. I don't really use it as much. Only like my in-home like consulting, like couple of clients and athletes a year. Not much now. And then in the PhD, we are graduating. We are graduating in August. We're graduating in August. You got to say it yourself 3 times so you know you do it. So, and then the other master's degree that I'm doing here simultaneously through the college, master's degree in sport leadership, more administrative type stuff, I know you're probably thinking I'm a wacko doing it at the same time as the PhD, but I just want to get it done before our baby comes in October.
Oh,
So
congrats.
appreciate that. Appreciate that. And then I'm also a really intelligent person too. I'm also writing a book at the same time. So again, not a great idea to do those three things at once while also getting a new job last July. But my thing was like, hey, get it all done now, get it out of the way. All of those things are to pour back into a field that has given me so much. So to me, I want to be the water to the plant, right? Like help the plant grow, help the student understand where to grow, how to develop, what skills to use and how to sharpen their tools, so to speak, so that when they go in the career field, and again, I come from S&C, but again, I'm helping students in all paths of exercise, health science. So helping them build communication skills, coaching or instructing skills, if you will, and exercise instruction. Also, how to write a program, how to prescribe exercise, what's a needs analysis, how to select an exercise, how to progress, regress, how to use progressive overload in the S&C world, but also known as graded exposure in the rehab world, because I have not worked in the physical therapy world per se. I was a PT rehab aide for 6 years within that gap. I've also worked in clinical settings as a coach, as an LMT, a fitness professional, and I attempted to go into 5 local Boston DPT programs for 3 years in a row. Never got in, but have since been paid to speak at 3 of them. So, like, I'm very fond of the PT path, and I have a lot of friends in the field, which I think is why I get along with a lot of PTs, and I see things similarly within my scope in the S&C and performance field, because you and I both know it's all connected. And that's a big thing I try to allow students to understand, whether you're in athletic training, physical therapy, strength and conditioning, whatever, like there are connections. And so it's just a matter of how you enter a situation with your credential and your license and what you're allowed and not allowed to do so that you're working in a team-based setting. So biggest, most important thing for me is paying it forward, which is why I'm here today.
That's awesome. And I think the best thing that you can have in the professional space is a network of reputable and respectable colleagues in other synergistic fields. And
Totally.
I do a lot of ACL rehab, and we as a company do a lot of ACL rehab. But what I start to realize, when athletes get 3-4 months post-op, we're able to start doing more things from a skill acquisition standpoint. And we'll use that graded exposure again. We start reintroducing running, and we can start reintroducing some multi-directional movement and some plyos and things that are kind of on the cusp of being appropriate to do, but they're still not something that you want somebody just doing on their own. It's the first time doing it. Maybe they still have some residual impairments that are good enough to initiate the movement, but they're not great enough to be able to do it without thinking twice. But at the same time, the person has now been strength training in month 2, in month 3. They are nowhere near where they need to be from a strength standpoint. But at this point, I don't need to watch somebody do squats or lunges or a lot of these things that they've already demonstrated competency and understanding with. They just need logical progressive loading and progression, whether it's stance progressions, intensity, volume, frequency, whatever we're trying to accomplish. And what I caught on to really quick was, if I can get the athletes back into a strength and conditioning environment as soon as possible, and I can connect with and build relationships with the trainers and the owners at those respective locations, it makes my sessions a heck of a lot easier to focus on the things I need to focus on. And if I've got, 30 minutes of direct one-on-one time with somebody, I want those 30 minutes out on the turf. And we're reintroducing running, we're doing multi-directional work, we're doing our plyo work. They still need to do strength training, but I can work on some of the things that are strength related that are more directly correlated to the other skills I'm teaching. And then I can say, hey, you're with me Tuesdays and Thursdays, Monday, Wednesday, Friday. I want you back in, you used to go to group exercise classes, you used to have one-on-one coaching done at whatever facility. Get back up with your coach and tell them this is what you can go to town with. And they can ramp up everything from a strength standpoint. You can spend as much time as you need in there and as much time as you need in here. They're synergistic and complementary, but they're not redundant at that point. Yeah. And I think that was something that that was like the light bulb for me, not trying to do every single thing, every session with somebody, and figuring out how can I leverage my resources and what I have within our facility, and then leverage the other resources. And athletes love it because, one, they get back into a routine and they get to hang out with their friends. They get to hang out with their teammates. A lot of these guys have been and girls have been working with strength coaches for 3, 4, 5, 6, 7 years. And when you tell them, hey, you can't see them for 9 months, like, you're doing them a disservice. So I think the more you can get them back into routine, the better. And I love how you had mentioned the failures you've had. And I think there's a level of authenticity and a level of humility that makes good teachers great teachers. And I will never forget the very first interaction we had at PT school. I went to University of Maryland, Baltimore, and we would go to Maryland College Park, and they had a ropes course there. And we did this a couple weeks before our first anatomy class. And it was kind of the icebreaker where we all got to meet each other. We had these kind of cool ropes courses where we had to work together, problem solve. It's like 95 degrees and humid, so we're all sweating, we're disgusting, and you learn how to get comfortable being around each other that you haven't met. But I remember at the end of the day, one of the professors, and he had been there for a while, and he was very, very respected in the Baltimore area, does a lot of niche like burn care, wound care, and he told us, he said, I almost failed out of PT school within the first 3 months of being there.
Wow.
And he said, I am telling you this because I busted my butt to get a 70% in a class so that I can make it to the next semester. And for him, he said, there are a lot of intelligent people here, and this is going to be the first time you're challenged. And you may have been able to just kind of go through the motions in middle school and high school and undergrad, show up, loosely listen, and then pass a test. And he's like, and you're about to get hit with a volume and a frequency of information you're just not used to getting hit with. And if you try some of those less structured ways of preparing for exams, you're going to be humbled like I was. And then he also came back and said, this may be the first time you've ever been in an environment where you have people and resources willing to spend the extra time to help you meet the needs of what you need. And that was what got him through PT school. And he said, just kind of swallowing my pride and saying, hey, I need help and I'm struggling. And then having somebody, dedicate some time to him, help him develop some better study habits and time allocation and time management. And I think a lot of times it's just, you've never done it before. You don't know what is the standard. You don't know what methods work and what methods don't work. But as a student, you need to hear that. And you are much more likely to pay attention in a class if it is a professor or a teacher or a mentor, somebody that you can relate to, and it's not somebody that you're just kind of blindly putting up on a pedestal as, oh, they've got their stuff together, they've mastered this, I'm nowhere near where this individual is going to be. And I think it's kind of that commitment to lifelong learning and humility, and really figuring out, like, we're in this together. And whatever side of the equation you're on as the mentor or the mentee or the teacher or the student, it is a collective group environment. So I always love when I hear people who are doing phenomenal things out in the field and they say, hey, this wasn't always easy. And guess what? It's not going to be easy for you, but we can find ways to make it a little bit more predictable, and we can find ways to be a little bit more intentional with how we do these things.
I love it. I love it. Thanks for sharing. Man, it's most people think it's like a perfect road, your career path. And one of the big things that I try to let students know, I'm like, you're gonna fail. You're gonna slip up. You're like, you remember Sandlot? Like Benny the Jet's mom? Like, look, you get into trouble, climb fences, get dirty, get rough. Don't get into too much trouble, but like that's how you learn. I think for me, having failed as many times as I have in my career path, academically, professionally, has been such a valuable lesson for me, because when you fail, you have an opportunity. You lose or you learn. And the hope is that you learn something and then you apply it. I mean, I have a great example this past weekend. Last week spoke at the High Performance Basketball Symposium in Orlando. Good friends with Charlie Weingroff. I look up to him as a mentor, and he pulled me aside, and everyone knows his name. He's been speaking publicly for decades, and he speaks on the Perform Better circuit. So do I. We're very fortunate to be a part of that. And he said, "Hey, I'd like to give you some guidance and some feedback based on X, Y, and Z." And I said, "Yeah, like I'm gonna be real with you. I made a few mistakes, like from a public speaking standpoint. And I have a public speaking coach, um, because I'm fortunate that I get to travel and speak a lot, and so I want to make sure I come correct." But he pulled me aside and gave me constructive criticism. That's the kind of relationship I have with him. So making mistakes, failing, I think it's good. Now you got to learn though.
Yeah.
So when I speak for NSCA national conference this summer and perform better Rhode Island, you better believe I will address those fine points to make sure that I learn from my mistakes and failures so that I become better for it. Because I think we're always growing and developing. I don't care how far into the field you are. I mean, I hate the word expert. I absolutely hate when people say it like about themselves or me. Like I never look at it like this. Had a great conversation with Mike Boyle in early March when he was our keynote speaker for our sport performance clinic here at the college, and he was talking about that as well. Like you're always learning, you're always growing, you're always developing. So I'm very fortunate to be surrounded by great mentors that keep me in a good place, and I remain humbled.
No, I love that. And it's always nice when you have the ability to receive constructive feedback and the openness to receive it as well. And I think a large part, what I have learned getting into a little bit more of the academic space and working with our residents who they've gone to undergraduate, they've gone to graduate school and gotten their PT degree. So now they're doing a postdoctoral residency, and you hit a certain point where there's only so much new and novel information to learn. Like the field of healthcare and fitness and strength conditioning, it only changes so quickly with regards to, new concepts and theories. But what we focus a lot on within the residency, and you alluded to this earlier, is there's a difference between knowing the theory and there's a difference between applying that. And I think a lot of what we try to focus on is it's one thing to be intelligent, and it's one thing to be able to have knowledge to pass a test. It's another thing to be able to pass on that knowledge to a consumer or to a patient or to a colleague, and being able to read the room and figure out, hey, am I at a Perform Better symposium where I'm in front of a lot of other colleagues and I need to speak within a certain level and within a certain language? Or am I at my local gym and I'm talking to a group of parents from a local youth baseball team, and I'm still talking about the same topic, but I need to present it in a manner that, one, is engaging, and two, that they're going to be able to walk out of here and tell their friends or tell their kid or whatever the same type of information, and making sure that message gets across. And a lot of the conversations that I find us having within our clinic when we're having some of these constructive feedback is like, I know what you were trying to say, but we need to figure out, one, are we conveying this message at a time where the recipient is willing to listen to it? Or do we need to work on the timing of that delivery a little bit? And then two, you just gave them a thesis dissertation's worth of information. There's no way they're going to remember that. Like, how can we chop that down and just give them the big picture stuff? And guess what? If they want more, they're going to ask a follow-up question. And if they want more, they're going to ask a follow-up question. So get them in, get the message across, get the big picture across, and if all they were to leave with was just that, make sure you've communicated it clear and concise. If they want more information, all right, this is when you get to get the big brain out and you get to show them how intelligent you are, and you can have that conversation. So I think that is something that I'm at a point in my career after practicing for 12 years now, and from a teaching standpoint, getting several years into it, where I'm trying to get better at kind of finding my own voice and being able to cater that same message to different audiences. And one of my favorite things to do is to listen to other people who are really good at either public speaking or just really good at coaching. And it's funny, like I'm a physical therapist, but some of the ways that I communicate it's ways that I think back to like what my old football coaches and basketball coaches did, or different coaches that my family members have had or that my kids have. And there's a lot of parallels in regards to running a team and running an organization and building a culture and establishing expectations and communicating what people are doing well and what they're not doing well. And it's funny, like you've been at a practice where you've seen a coach completely butcher the tempo of a practice because they've got a good thing going, it's going at the pace they want, and then they stop a play because somebody does something wrong, and they spend 30 minutes dissecting what was done wrong to the point where now it's a disjointed practice. Whereas,
Yep.
and it's no different than like, hey, I'm warming somebody up, and the whole intention of this 5 minutes of activity is just for GPP. And we just want respiratory rate to increase. We want heart rate to increase. We want to get them just actively engaged. I'm doing them a disservice if I'm nitpicking what their body weight squats look like, if it has nothing to do with the outcome of the task or the safety or the execution of it. And it's kind of fun when you start to get into realizing that there are levels and layers to all of this. And the
Totally.
two things I kind of want to touch on before I let you run, making the transition into the academic space. What are some surprises that you have seen from a positive standpoint? Like, how has it made you better as a coach or as a professional or on a personal level? Like, what have you found enjoyable about making this transition of, 14 years out doing your thing, and now you transition into more of a full-time gig? What have you learned from a positive?
The biggest thing, number one, that I've learned is patience. And I'll be specific. The current, and like, I'm 35. Like, I'm not saying like the youngins these days, but you have to put yourself in the mind of an 18 to 22-year-old now. And I don't know about you, but like when I was 18 to 22, like I still had a flip phone.
Still playing Snake on that
Instagram
thing.
wasn't, say again?
You're still playing Snake on that phone too,
Yeah,
probably.
still playing Snake, maybe a little Tetris. Um, and Instagram wasn't, I don't even think Instagram was around at that point. Facebook was obviously around. LinkedIn, I'm not even sure I knew of, even if it existed. Twitter probably was around. I mean, MySpace was still around. So to now where there's TikTok, there's this, there's that, there's like there's threads, I mean, everything is just so from a consumption standpoint, if you're someone in our field trying to take in information, unfortunately, at that age, they're going to use social media as their form of information and education. So I think there's this big patience that you really have to exhibit with these young up and coming professionals and say, hey, look, because they'll ask you questions. Hey, what you're looking at, that's awesome. But like, time out, pause, right? Like, a la like Zach Morris, Saved by the Bell. Mr. Belding like freezes, right? And like, let's take a step back. What's the context? Don't ask me if this is good or bad. Ask me, where can I apply this, if at all? That's a better question to ask. So I think it's really good to force these young up and coming professionals to slow down. Don't be in a rush to go places. Appreciate the journey and the process. And I'm sure you see it too. Like, hey, what's the answer? No, that's not how it works. I'm going to help you understand the process, understand the story, the journey, so that you know what it takes to get from point A to point B. And whereas, like, don't rush to the answer. Don't rush to the end of the race. Appreciate the race. Appreciate the journey. Whether it's problem solving, critical thinking, that's something we do in the exercise program design course. I call it exercise logic court. For Halloween, I dressed up as the judge. So we have a case study. Athlete A, athlete B. And you look at performance goals, you look at some like maybe some counter movement jump height, you look at some injury history, where they're at, which sport, where they're at in the year. Okay, what exercise would you prescribe in this block? Why? What's your rationale? Explain it to us. So I'll challenge students academically to force them to slow things down and to think critically and to use problem solving skills and to conduct a true needs analysis when you're writing a training program and you're prescribing exercise. So I think slowing students down, being patient with them, that's a big thing. It's huge. Something that I've really taken a liking to. And this started when I was an internship coordinator at the gym that I co-owned, a few miles down the road from 2017 to 2021. Being an internship coordinator on the preceptor side, like owning the gym, or I guess, if you're in a PT clinic, like accepting students such as yourself, right? Like you accept students. I really loved helping them in that process. and that feeling of they need me, right? Like I want them to need me up front, but then eventually I want them to, you don't need me at all. Like you've graduated, go crush it now. You have all the skills and tools to be able to be awesome in life in your career path. So that initial need that I really enjoy them to need me up front, but I love it even more when, I'm their accountability partner and then they graduate and they don't need me at all because they become smarter and better. And that's what I want for them. So that process is really neat as well for me. And just, hearing good stories about our students going on and being successful. Like we had a student who was a student of mine here, who was in the weight room with me here, who also did my Athletic Performance University APU online SNC mentorship, who then she landed a gig with the Florida Panthers as a strength coach and hockey coach a few months ago. So hearing and seeing stories like that is just amazing. It's really rewarding and it makes you appreciate why you do what you do.
That's awesome. And I didn't realize that was the actual course that you taught, the exercise program design. I was an exercise science major for undergrad. I went to Salisbury University, and Matt Nine is the strength coach at Salisbury, and he also taught several courses in exercise science, and that was the one that he taught. Out of everything that I do with my patients, when I look back, and obviously you need to know the anatomy, biology, physiology, but on a day-to-day basis, I honestly believe the theories and the concepts that I got from that undergraduate class as part of that strength conditioning section is the most clinically applicable thing that I do on a day-to-day basis. And I also remember getting done that class, and you learn Matt was phenomenal. And if anybody doesn't know who he is, I would highly encourage you to look him up because he does really, really great work, and they are spoiled at the Division III level to have him as their strength coach. But I remember graduating, and it's like, all right, I got to write this program for somebody. Like, where do I start? And like you mentioned, there's not really a perfect answer. It's, hey, you have the roadmap here. And he would always encourage us, like, just put something on paper. Like, do your needs analysis, figure out what the goals are, figure out the duration of time you have and what your big macros are. And then guess what? You're going to pre-test them, and you're going to test them on the way and see if it's working. And if it doesn't work, make some changes along the way. It's a living document. And as long as you stay true to what those central themes are, like the nuance of swapping in an exercise here or there, changing a set and rep scheme, as long as it's fulfilling the big goal and it's intentional and you can track and measure it, like you're just majoring in minutia at that part. So don't get as intimidated. But no, Matt, I appreciate you taking the time. I know you have got a very busy schedule and day, but my understanding is I think that's probably what motivates you and keeps you moving. So as always, I appreciate the time and you coming on here. For individuals listening, if they want to learn more about you or they want to get in touch with you, what is the best way for them just to stay connected?
Yeah. So number one, Zach, appreciate you having me on, man. I'm glad we could chop it up. The easiest way to connect is my website. So athletic performance, the letter U.com. That's where you can find everything, the newsletter, the course, everything. And then obviously on Instagram as well, just my first and last name and underscore. Imagine that some jerk has my last name as well. But those two places would be the best place to find me. I look forward to engaging and interacting. And again, Zach, thank you for having me, and I really appreciate this. I had a wonderful time chopping it up with you.
Absolutely. Next time I'm up in the Mass area, I'll have to hit you up. And same thing when you're
Please
down in the DMV. So,
we definitely have future collaborations. I can smell it.
Perfect. All right. Well, for those listening, this is the Strength and Knowledge Podcast. This is your host, Dr. Zach Baker. If you enjoyed this episode, please like, share, and subscribe, and stay tuned for our next episode.